A special investigative report from an ABC7 team in San Francisco recently uncovered a cybersecurity breach spanning across the globe. Malware planted in medical devices at major healthcare providers around the world may be affected, according to San Mateo-based cybersecurity experts at TrapX, who performed the check. So joining me now to discuss the company's findings, CEO of TrapX, Greg Enriquez. Greg, thanks so much for being with us today.
Thanks for having me.
First, can you tell us how TrapX discovered this breach and what prompted the medical facility to contact your company in the first place?
Absolutely. TrapX first discovered the MedJack breach in 2015, and now we've seen it again in 2016 and 17. We're installed in hospitals across the globe in North America, Europe, and the Middle East. And in those hospitals, we're installed to protect their systems with our TrapX security software. And while watching their business systems or administrative systems, our equipment detected malware on medical devices. When it was first seen, the malware was in unpatched or back-level operating systems operating on medical devices.
And can you tell us how this type of breach can actually impact a patient directly?
Well, the types of devices we're speaking of, in the first instance, we found it on a blood gas analyzer, which is something that would be in the surgery room or in a patient's hospital room. We've also seen malware on PACS systems, X-ray devices, and also MRI equipment. Any medical equipment that has potentially an operating system that can be attacked is susceptible to this.
And why is it that hackers want a person's medical records?
Well, there's multiple reasons. There's certainly financial gain. We see today that medical records, someone's profile and their personally identifiable information in a hospital record is worth sometimes 10 to 20 times more than credit card information. They get a full picture of the individual, including social security numbers and other important data. There could be nation states trying to profile individuals that may want information about those individuals. And there also could be intellectual property about drugs or medical devices or research to help countries do better in their own way. And then, of course, there's the hacktivists. There's those that may want to disrupt the organization because they're protesting something that organization is backing. It could be a teaching hospital, something tied to a university, or someone just has a problem with the way a corporation or hospital corporation is reacting.
Now, in your experience, have you ever seen anyone hacking medical records to simply do it out of malice, to just harm innocent patients?
I have. What we've seen so far would be the exfiltration of medical records, and our suspicion is it's for financial gain. I mean, if you look at the even some of the past breaches, like the OPM breach that was very publicized and others, it was concluded that there was either financial gain or information about individuals that was being stolen.
And are these devices then, are they all online? Is that how it's happening?
Well, that is what's happening more, and you'll see reports from the FDA that more and more devices, as we all see every day, you think about what'd you get for Christmas, does it have something to do with healthcare? More and more devices are connected. Hospitals' operational technology has been connected in the hospital networks. It's good to keep those connected on private networks. Sometimes they are connected and need to be connected to the internet to transfer information. Think about it. If you have to transfer radiology information from a hospital to a doctor's office to a radiologist, it has to have access to an open network to get there. It just needs to be protected. But this gives a doorway, a way for attackers to get in, either by spear phishing someone in the hospital or by doing a drive-by and getting onto that medical device. And once they get on a medical device that has potentially a back-level operating system, they can dwell there before coming out and hitting maybe the administrative systems to get patient information. There's clear guidelines from the FDA to protect patients from this, but we have a very large hospital infrastructure in the world. Not all the devices can be updated and patched in a timely fashion, and the bad guys have figured out a way to take advantage of this.
Do you ever think that maybe some of the people working at these facilities might be a part, like an inside job?
Well, TrapX does monitor for insider threat. We deploy a network to gain visibility inside the network for threats that would come from the outside or may come from the inside. I think it's more people who are trying to do their job and maybe make a mistake by clicking on something they shouldn't or going onto a website they shouldn't be on.
I see. So not necessarily a malicious act. And how would a person protect themselves against this sort of medical hacking? Or are we sort of at the mercy of how our chosen medical providers keeps protecting us?
Well, we always need to make sure that our personal information is protected. That's by asking the organizations to make sure that your information is kept secure and not left in the open or not put on systems that may be accessed by outsiders. So there's good hygiene with protecting your personal information. Clearly, the organizations that support us are working with government to make sure the proper process is in place, that they're monitoring systems for updates and patching vulnerabilities and making sure that there's a process for maintaining the security of these devices. But we as individuals have to protect our information and make sure it only goes into places that we know those organizations are protecting what they have for us. And there's guidance, there's the HIPAA rules, and there's others to do that. But you always have to stay one step ahead of the bad guys because they're always trying to figure out a way to make money or to cause problems with access to these systems.
It does always seem like the bad guys are always one step ahead, but thank you guys, people like you, for being there. Thank you so much for that. Greg Enriquez, CEO of TrapX.
Thank you.